Hi everyone, I'm Dr. Divya Shanthi and welcome to NEET PG Core Revision series. These series are focused, structured and exam oriented so that you can recall faster and more confidently in your exams. In today's session, we are going to break down the rotator cuff muscles and their injuries into clear, high-yielding, exam-focused concepts. So let's get started. So when we say rotator cuff muscles, okay, so why do we call them as rotator cuff muscles? So rotator cuff muscles, they are around the glenohumeral joint. So they are present around the glenohumeral joint, which we commonly call as the shoulder joint. And they form a cuff, okay? They hold this shoulder joint in position and forming a cuff. And since they help in the rotatory movements, we also call it as the rotator cuff. So they form a musculotendinous cuff, as well as they help in the rotation movements mainly. So let's see which muscles form the rotator cuff. So to remember the rotator cuff muscles, we have the mnemonic SITS commonly. So S is for the supraspinatus here, which we see on the dorsal aspect of the scapula. Then we have the infraspinatus beneath that, and teres minor below. Then the last S is for the subscapularis muscle, which we see it on the costal surface of the scapula. So these muscles, they are the rotator cuff muscles. Now let's look at their origin and insertion, like how, because origin and insertion will tell you how they bring about the movements. So on the humerus, we have two tubercles, the lesser and the greater tubercle. There is the lesser tubercle, there is the greater tubercle on the humerus. So these muscles are inserted around these tubercles. So the subscapularis muscle is inserted to the lesser tubercle, whereas the supraspinatus, the infraspinatus, as well as the teres minor, they are inserted to the greater tubercle. So subscapularis comes from the costal surface of the scapula and gets inserted to the lesser tubercle. Supraspinatus, the supraspinous fossa on the dorsal aspect here, we can see this one, and infraspinatus here on the from the infraspinous fossa of the scapula on the dorsal aspect, and along its lateral border we will see the teres minor. This is the teres minor. So these muscles, they have the origin from the scapula and they get inserted around the humerus, that is to the tubercles. So because of that, they form kind of a cuff holding the glenohumeral joint in place. So this is the glenoid cavity of the joint. This is the glenoidal, so this is the cavity, and this is the labrum. So around that we have these muscles. So this is the subscapularis. Here we have the supraspinatus. This is the supraspinatus. This is the infraspinatus. And this is the teres minor. Okay. So these muscles, they form a musculotendinous cuff around the shoulder joint. So what action do they bring? So now you can see how they are holding the head of the humerus in place, right? Because in the shoulder joint, glenohumeral joint, the two articulating surfaces are not congruent. They are not of equal size there. Okay, the glenoid cavity is much smaller compared to the head of the humerus which articulates. So that is why to provide the stability, we have these rotator cuff muscles. So like how the fingers are wrapping around the head of the humerus. In the similar fashion, we have the muscles. So the thumb represents the subscapularis. This is the supraspinatus and middle finger infraspinatus, and the ring finger here is for the teres minor. This is the teres minor. So subscapularis is basically the medial rotator of the shoulder joint. The supraspinatus mainly brings about 15 degree, the first 15 degree abduction. Infraspinatus and teres minor, they are mainly the lateral rotators. So that is the movements, actions of these muscles. Next, let's see the clinical correlations. So these rotator cuff muscles are the most commonest injury which we see in the shoulder joint, and they are the main cause for painful shoulder joint also. So usually we see it in males above 50 years of age. It is more common. So this is mainly due to, that is, repetitive use of the shoulder joint above the horizontal level. Now if you take this as the horizontal level, the repeated use above the horizontal level brings about these conditions. Okay, so there are two conditions. One is the calcific supraspinatus tendinitis, and the other one will be the subacromial bursitis leading to 𝗕𝗵𝗂 syndrome. So let's see them. So this calcific supraspinatus tendinitis. So here what happens, because of this repetitive use of the shoulder joint, especially which we see it in throwers, okay, like in the bowlers, then swimmers, okay, so we see this injuries more commonly in them. So that causes the repeated pressure over the supraspinatus. This is the supraspinatus tendon. Okay, so here because of that pressure and inflammation, it causes calcium deposits. So here calcium deposits are there. So this causes the calcific supraspinatus tendinitis. So this calcium deposits, what happens is during the movement. So supraspinatus, I told you, it brings about the abduction, first 15 degree of abduction movement. And during that period, there is always pain. Okay. So here in the X-ray also, you can see this. This is the deposit, calcium deposit, which you can observe, calcium deposit, which you can observe in the X-ray. So this condition leads to the second condition, which I told you is the subacromial bursitis. So this is the subacromial bursitis. So the subacromial bursa, okay, it is the largest bursa in our body. It is present beneath the acromial process. So it is between the acromial process here and the supraspinatus tendon below. So this bursa, because of these calcific deposits, it is repeatedly irritated, and that leads to its inflammation. Okay, so what happens? Inflammation and swelling. So what happens is during the abduction movement, it gets impinged. Here when we abduct the arm, okay, that is at the shoulder joint, when we abduct, there is impingement of that bursa, and that leads to pain during abduction. And that pain is more during 60 to 120 degree of abduction. Okay, 60 to 120 degree of abduction. So this is known as the painful arc syndrome. So these are the conditions which we see due to injury to the rotator cuff. Now let's see some of the MCQs. Here the MRI shows superior aspect tear of shoulder joint capsule. Which tendon is most commonly torn? On the superior aspect, which tendon do we see? Here it is the supraspinatus. So safely you can choose the C choice. Okay, it is the C. That is supraspinatus. Subscapularis comes below because it is inserted to the lesser tubercle. Infraspinatus is below the supraspinatus, and long head of biceps is not a part of the rotator cuff. It passes through the bicipital tendon, though it is passing through the capsule of the, that is within the capsule of the shoulder joint. Okay, so that is how we rule out the other choice. Which muscle is not a part of rotator cuff? Okay, so rotator cuff muscles we know as sits muscles, which are supraspinatus, infraspinatus, teres minor and subscapularis. So we have supraspinatus, infraspinatus, teres minor. So teres major is the wrong choice. So that muscle is not a part of rotator cuff, teres major. Next question, which tendon is most commonly torn? Okay, so there is tearing here. Okay, so which is this tendon? So there at that level, which tendon comes beneath the acromial process? We know that as supraspinatus. Yes. So supraspinatus is the right choice. So do we have that? Yes, supraspinatus is here. So C is the right choice. Supraspinatus muscle. Subscapularis, infraspinatus, they are not around that point. Okay, they are not commonly torn also. Long head of biceps is not a part of the rotator cuff. Next question, a cricketer develops chronic shoulder pain worsen during overhead activity. Imaging shows narrowing of subacromial space. Which structure is most likely compressed? Okay, so there is narrowing. So if you observe the X-ray here, okay, so here you can see there is narrowing of the space. Okay, the space is narrowed, right? So which structure is most likely compressed? Okay, so there we see two things there. One is the subacromial bursa, other thing is the supraspinatus tendon. So let's see among the choices what is mentioned here. All the tendons are mentioned: subscapularis tendon, infraspinatus, supraspinatus, teres minor tendon. So the right choice will be the supraspinatus tendon. All the rotator cuff muscles are rotators of humerus except, okay, so when we see the sits muscles, we know the subscapularis is a medial rotator, brings about medial rotation. Infraspinatus and teres minor mainly the lateral rotation. Supraspinatus mainly responsible for 15-degree abduction. So which is the choice? Yes, the supraspinatus. Supraspinatus will be the right choice. So all right, and that's rotator cuff or rotator cuff muscles as well as the injuries made simple for you. So see, stay consistent with the series because consistency will beat the last minute stress. So I will see you in the next session. Thank you.